Hello everyone, my name is Kelsey Zimmerman and I'm going to discuss electronic health records or EHRs. So an EHR is a digital version of a patient's paper chart. EHRs are patient-centered records that allow authorized users to access information regarding a patient's medical history, diagnoses, medications, etc. Additionally, EHRs give providers access to evidence-based tools to make more informed decisions about a particular patient's care. And ultimately, EHRs are built to share information with other healthcare providers and organizations. So here is a brief history of EHRs. In the mid-1960s, the earliest data processing systems surfaced and focused on clinical data management. Also in the 1960s, the development of the problem-oriented medical record by Larry Weed introduced the idea of using electronic methods of recording patient information. And then in 1972, the first electronic medical record system was developed. Initially, it was unpopular by physicians due to high costs, so government hospitals used it. Then in the 1990s, the internet emerged, which allowed for access to vast amounts of information. As a result, health information online was introduced, which would eventually lead to web-based EMRs. In 1996, HIPAA was introduced, and then in 2004, President George W. Bush, at his State of the Union address, said that by computerizing health records, we can avoid dangerous medical mistakes, reduce costs, and improve care. And he outlined a plan to ensure that most Americans would have access to EHRs within the next 10 years. And then in 2009, President Obama calls for a national EHR system. So then we come to this concept of meaningful use, and meaningful use sets specific objectives that eligible professionals and hospitals must achieve to qualify for the Centers for Medicare and Medicaid Services, CMS, incentive programs. So basically under the American Recovery Act, and Reinvestment Act, which is a piece of legislation aimed at directing additional funding and incentives to healthcare professionals who adopt these electronic medical systems and follow meaningful use by the year 2014, they can gain incentive payments. So, and based on the size of the health system and implementation, these incentives can be millions of dollars. And on the other hand, penalties will ensue for the hospitals and providers who don't want to comply with meaningful use. So, the benefits of EHRs are improved patient care, improved care coordination, practice efficiencies and cost savings, increased patient participation, and then improved diagnostics and patient outcomes. So with EHRs, providers have access to the information they need about a particular patient in one place. EHRs do provide a more cohesive picture and allow providers to make decisions about care quicker. And then with EHRs, providers can manage appointment schedules electronically and exchange email with their patients, which can lead to quicker treatment or perhaps preventing a patient from having to come in at all. 13 Rand study identified factors affecting physician professional satisfaction related to EHRs, some of which were time-consuming data entry, interference with face-to-face care. So time with doctors is already limited, and a common frustration was that it was difficult to multitask typing and giving 100% of attention to the patient, significant financial investment, decreased efficiency, insufficient health information exchange, so physicians in multiple specialties and a range of practice settings described frustration when health information was not exchanged between EHRs, even when those other practices had implemented EHRs and instead were faxing over patient information. And then user interfaces that don't match clinical workflow. So EHR implementation, Mercy Health in 2010 implemented a system-wide EHR. So they implemented health IT systems in all physician practices and many of their hospitals. And the result was increased safety, quality, and efficiency. And under meaningful use, more and more hospital systems are beginning to do this. So consumer views on EHRs. A study by the National Partnership for Women and Families Engaging Patients and Families, How Consumers Value and Use IT, follows up on a similar 2011 report that assessed consumer views towards EHRs. And basically, from that report to now, there's an increased comfort with digitized records, and more consumers are accessing, sharing, and using their health information. And online access to health records doubled from 2011 to 2014. So people are starting to become more active in their healthcare. Conversely, there's also a fear of private and sensitive information falling into the wrong hands with all the data breaches that happened in 2015. So this table lists the top 6 data breaches, and each of them affected at least 1 million people, with the Anthem breach affecting nearly 79 million people. So privacy is definitely a concern for many people. So the future of EHRs, I believe EHRs will be implemented across the continuum of care, so moving beyond acute care and clinic settings to areas such as home health, long-term care, behavioral therapies, etc. Also, a large emphasis will be on relieving physician burden. So the Health Information Technology Act helps alleviate physician burden by allowing non-physicians and members of the care team, such as scribes, to document on the physician's behalf, and ultimately this allows the physician to practice at the top of their license and provide quality care. And changing care models and reimbursement require healthcare organizations to embrace technology and EHRs. It's important for organizations to be able to aggregate reports and results to receive reimbursement, and EHRs make tracking patient interactions throughout the healthcare system possible. So my questions for you all are, is your overall impression of EHRs positive or negative, and why? What do you think is the biggest benefit to having access to your healthcare information, and what measures do you think healthcare organizations need to take in order to protect patient health information? Thank you for listening, and I enjoyed reading your discussion posts over the next week.